Hi, David.
Hi, Eric.
How are you doing?
Very well, thank you. Good to see you.
And good to see you as well. Hey, David, look, first of all, big thank you for taking the time out again of your busy clinic at Total Foot Health, seeing your
Thank
patients
you for
there.
having me.
No, my pleasure to have you on board today with it for this conversation. And today we're going to be speaking about bunions, something I know a lot of people have spoken about and speak about with their feet. But before we get into speaking about bunions and looking at some of the symptoms, causes, and treatments, maybe to share a bit about the background of Total Foot Health, please, if you would.
Thank you. We are a podiatry clinic based in Salisbury. We've been here for over 10 years now, and we have a large team of 4 podiatrists and 2 foot health practitioners and a rehab therapist. And we have a range of technologies such as video gait analysis to help us look at how people move, and an ultrasound scanner that helps us look inside a person's foot to look at the problem they're having.
Yeah. So as the name suggests, Total Foot Health, you really do provide a full complementary suite of modalities, treatment modalities to help assess and treat your patients, which is fantastic. So we're going to talk about bunions today, but before we get into talking about bunions, just to make it clear to anybody listening to this conversation we're having today, this is not designed to be for diagnosis or for treatment. In order to have a proper treatment plan created for them, they would need to come in and see a podiatrist like yourself in order to have a full assessment to get that treatment plan.
Absolutely.
I just want to make that clear at the outset. So we're talking about bunions. So David, what are some of the common symptoms that people might be exhibiting when we're talking about bunions?
Well, people might be aware of a hard bony lump around the side of the big toe joint. Maybe it's got a bit larger. Maybe they've noticed their big toe starting to move over towards the second toe, making the foot a bit broader. And then that starts to cause problems with footwear. Maybe they're getting a rub on the side of the big toe in certain shoes. They may notice that the toes next to the big toe start to change shape. They start to buckle into what we call a hammer toe shape, and they may get other symptoms in the ball of the foot. So not necessarily within the bunion itself, but directly under the ball of the foot can start to be painful.
Yeah. And that's pain that experience when they're walking, stepping up things, and
some people it can be just finding a shoe that fits. It can be painful the moment they put the shoe on, but for other people it may be with activity, like you say, they start getting the pain with the more activity they do.
Right. Okay. So those are some of the common symptoms that somebody may exhibit when we're talking about bunions. So what are some of the typical causes of bunions then?
There's a lot of debate as to actually what causes a bunion, but there are foot-related characteristics that can make it more likely, such as people with a very flat foot or a longer big toe can lead to that change in position, and genetics. So having a family history of bunion can make it more likely. People who are very flexible with hypermobility, that can mean the big toe is more likely to change shape. And some inflammatory conditions such as rheumatoid arthritis.
All right.
But tight-fitting shoes tends to get the blame. We can't blame it all on footwear, but certainly tighter-fitting shoes don't help, and they can make symptoms much worse.
Yeah, and I wasn't aware that it could be an hereditary condition.
Yeah. Most of the time, someone with a bunion, there will be a family member who has had a similar problem themselves.
Right, that's interesting. That's interesting. So there are some of the symptoms, some of the causes. So again, what might be some of the treatments then for treating bunions for an individual, having had that assessment with you?
So like you say, once they've seen the podiatrist, had an assessment, and we've diagnosed the problem, we'll look at, if it's mainly symptoms, we'll look at accommodating the shape of the foot with sensible footwear, and exercises to improve balance. But if the problem isn't well managed, we may look at referring them on for made-to-measure footwear, or we can provide treatments such as custom-made foot orthoses to wear inside their shoes to help support the foot. Occasionally, if there's pain in the ball of the foot, we may offer an injection with some corticosteroid.
Yeah.
But ultimately, if the problem isn't well managed and people have tried all the conservative measures, then we may recommend referral to a podiatric surgeon, that's a specialist surgeon who operates on feet, and they can have a look and potentially offer surgery to realign the toe, and which is the only way of really getting rid of a bunion.
Okay. And something I like about the way that Total Foot Health operate, and you as podiatrists, is you do start off with this and can start with this conservative, non-invasive approach, where you mentioned you can accommodate the foot shape to begin with, and then you can take the patient where necessary on this patient journey, offering different treatment modalities as and when appropriate, which I think is really good to know from a patient point of view, that you're going to be starting off at one side, and that may well be it. That may well be the solution, but you have got other options as well.
Absolutely, yeah. We'd always recommend avoiding anything too invasive to begin with.
Yeah, that's great. David, look, once again, big thank you for sharing the time to talk about bunions and how, you know, the symptoms are causing some possible treatments, again, on the back of a face-to-face full consultation. So for anybody listening today that is maybe struggling with or thinks they may have bunion problems, how can they go about getting more information about Total Foot Health and how you can help them potentially?
They can do so going to our website, totalfoothealth.co.uk, and there's information on the range of services we provide, as well as our contact details, our phone and email, etc. Fantastic.
Hey, look, David, once again, big thank you for taking the time out today, and I'm sure we'll be speaking again about more foot problems in the not too distant future.
You're welcome. Good to see you.
Okay, good to see you. Take care. Bye for now.